Hello everyone, I'm Mrs. Princey, Associate Professor in Mental Health Nursing. We have got many condition, which is one of the mood disorders. Before a person gets the manic disorder, there is a condition which the person may be suffering from, right? Which is of a lesser degree compared to the mania. That means just before the patient goes on to the mild episode of mania, he will have certain symptoms which are similar to the mania. So that condition is called as the hypomania. So as the name itself says, hypomania is a lesser degree of mania, or we can say it as under mania. So the topic for today is hypomania. Hypomania is a mood state characterized by persistent disinhibition and mood elevation. So here the mood elevation is the minded elevation, the mood which is the first stage, euphoria, with behavior that is noticeably different from the person's typical behavior when in a non-depressed stage. So you can see that hypomania is a lesser form of the mania wherein the person will have a mild elevation in the mood, that is the euphoria, which you can notice even in a non-depressed stage. Hypomania may also involve the irritability, but the irritability will be, less severe than what you see in the actual manic disorder. So this is the definition of hypomania. What are the characteristic features or characteristic behavior of hypomania? Number one, there is a decrease in need of sleep. As you see in mania, also there is decreased need of sleep in the hypomania. You can see that overall there is an increased energy level as you see in the mania, but there is a mild increase in the energy level or the enthusiasm. You can note that there is unusual behavior or action that the patient will exhibit. You can also see to it that there is a marked increase in the talk of the patient, that is a mild increase that you can notice in the talkative level, and also mild increase in the confidence level of the client. You can also notice that there is a mild form of flight of ideas or shifting of topic from one topic to another. Other symptoms such as delusion of grandiosity, distractibility, as well as the hypersexuality also is seen in the hypomania. So these are certain symptoms that you can notice in hypomania, which is similar to mania, but everything will be in the milder form. That is called as the hypomania symptoms. Moving on to the causes of hypomania. Prior to the emergence of the manic episode, maybe the client would have had a history of depression. That can be a long history or a recent history of depression, or there may be combination of hypomania as well as depression, which is the previous history which can be noted on the history assessment. If you take the age group, it is usually seen in the mid to late teenage children, okay, or the group that you can notice the hypomania. And most importantly, hypomania is associated with the narcissistic personality people. So people who are always having the self-important ideas or preoccupied with their own self. So such kind of a personality who are narcissistic type of the personality are at more risk of developing this hypomania. What are the clinical features of hypomania? Persistently elevated, expansive, irritable mood which continuously lasts for at least 4 days. That is why persistently, if the person is having a elevated, expansive, irritable mood for a period of 4 days, that is usually different than during the non-depressed state. Then you can diagnose a patient as having hypomania. So soon after these 4 days or a week, in case of mania, the following symptoms should be there at least for a period of 1 week, then you can diagnose it as mania. When it comes to hypomania, these symptoms, that is the elevation in the mood, the expansion in the mood, as well as irritable mood, should be there persistently in the patient for at least a period of 4 days. You can diagnose him as having the hypomania. The next symptom is inflated self-esteem as well as the grandiosity, decreased need for sleep, rested only for 3 hours. He will be more talkative than usual. Also, he will have symptoms of flight of ideas or the racy thoughts, wherein there will be rapid shift in his thought or ideas. He will have the symptom of distractibility, that is even for the stimuli which is very much irrelevant or the unimportant stimuli also, he gets very much distracted. Okay, so that symptom you can notice. You can also notice that there is an increase in the goal directed activity. Yes, he has got many goals to fulfill, but he will not complete his goal or task. You can also notice this increase in the goal directed activity. It can be related to social activity or a work or an occupation related activity. If you see in the teenage period, a school or assignment, so such kind of activity, he will have a goal, many goals he will have to complete, that enthusiasm he has, but he will get easily distracted, because of which he will not complete any of the tasks. You can also notice the sexual activity will be increase in the psychomotor agitation or the psychomotor activity, restless behavior that you can notice. You can also notice this key feature, excessive involvement in the pleasurable activities that have a high potential for painful consequences, right? So he will involve in such a kind of activity which he gets a lot of pleasure, but he will end up resulting in the painful consequences. Say for example, the patient engages himself in the unrestrained buying spirits. Okay, whatever he sees, he will buy those things and he will keep it with him. Okay, just like shopaholic. And there is no goal or there is no reason of buying a particular object or a substance. Whatever he sees, he just foolishly he will buy those and keep it with him, thinking that he's spending the amount socially for the people. Or he may just distribute the money to the strangers, whoever is walking on the way, whoever he finds across, he will just distribute the money. Or he will have a foolish investments in the business. He will also have the sexual indiscretion. So such kind of pleasurable activities that he will do, which will end up in the painful consequences. So these are the clinical features of hypomania. Moving on to the treatment. So what is the treatment option that we have for hypomania? Number one is the antimanic drugs that we use to control the acute attacks of hypomania. Along with that, to prevent the recurrent attacks of hypomania, we also give the psychosocial therapies, right? So that is one of the treatment options. So the recommended treatment option, the range of treatment goes for about 2 years to 5 years. So that is the total duration or the length of the treatment, that we have. We may also have the use of antidepressant drugs, but it is avoided in the patients who have had the recent history of hypomania. So this is the treatment option that we have for the hypomania. When it comes to the drugs, the antimanic drugs which are used are lithium, sodium valproate. We use the sedatives like clonazepam and lorazepam. So these are the drugs that we use for hypomania. So other than these drugs, we have the other drugs like aripiprazole, clozapine, haloperidol, olanzapine, quetiapine, and risperidone. If the patient is having the psychotic features, we'll be using the antipsychotic agents also to control those symptoms. So these are the treatment options which is available, psychopharmacology as well as the psychosocial. Moving on to the nursing interventions. What is the nursing management of a patient with hypomania? So when it comes to nursing management, you have got the assessment, the nursing diagnosis, and the intervention. So what is the assessment that you are doing? So you're doing the judgment of the symptoms. So what is the severity of the symptoms? So based on the mental status examination that you do, you get the symptoms, the list of symptoms. What is the severity of the symptoms that you're going to determine? What is the patient's capacity to work? How is he involving with the family members? What is his relationship or interaction with the family members, significant others, and the occupation related areas that you're going to find out via the history collection. You're going to find out what is the thing or the cause which provoked the patient to end up with hypomania. So it can be triggered by certain factors like physical illness, the recent physical illness, any kind of a treatment with the drug, especially the steroids, or any kind of the surgical operation. So all these are going to act as a aggravating or a triggering or precipitating factor. So going to find out if these are there. What is the nursing diagnosis for this? Number one, impaired social interaction related to short attention span, high level of distractibility, and labile mood evidenced by insufficient or excessive quantity or ineffective quality of social exchange. So this is one of the nursing diagnosis. The objective data includes the patient will demonstrate acceptable interaction with others. So what are the interventions for this problem? You have to identify the factors or the causative factors which are precipitating or elevating the patient's, provide an environment which is free from all the distractions or environmental stimuli. Give the instructions to the patient slowly using the simple language. When the patient is able to complete the particular task or showing some acceptable behavior, always give a positive reinforcement to the client when he completes each of the step in the particular task. You have to see to it that you protect the other clients when such a kind of a patient who is there with hypomania can easily influence the other patients, especially who are very much vulnerable and also who are having non-assertive kind of a behavior. So those patients will get influenced by such kind of the hypomanic patients. So see to it that you protect those clients also. So that is about the interventions. Moving on to the next nursing diagnosis, ineffective coping skills related to the poor impulse as evidenced by acting out behavior. So this is another nursing diagnosis. What are the interventions? State the rules, expectations, and responsibilities of the patient in clear terms, including the consequence of the particular limit. So if he crosses this particular rules or regulations, what are the punishments or what are the consequences he has to face? That has to be clearly instructed to the client. When the client loses the behavior control, see to it that you use the behavioral techniques to modify the behavior, for example, the timeout. Encourage the client to verbalize his feelings. Teach the client the simple problem solving techniques like listing out, choosing the alternatives, evaluating those choices, and selecting the implement and select and implement on the alternative whatever is chosen. The next nursing diagnosis, disturbed thought process related to disorientation and decreased concentration as evidenced by disruption in the activities. What are the nursing interventions? Whenever you interact with the patient, always see to it that you interact in a calm and relaxed way to the client. Set and maintain limits on the behavior. So certain behaviors which are destructive or the behaviors which can adversely affect the other clients, you always have to monitor that and set limits on such kind of the behavior. Always see to it the environmental stimuli is kept minimum. If the client has behaviors of restlessness, agitation, always see to it that the environmental stimuli should be responded well to the client. In a sense, you minimize the environmental stimuli so that it will not become overwhelmed. If possible, see to it as much as possible to provide a single or private room to such kind of the patient because it should not disturb the other clients. Always see to it that you provide a consistent structured environment to the client and also tell him what is expected behavior from him and set the goals according to the expected behavior. The next nursing diagnosis we have the risk or potential nursing diagnosis, risk of injury related to inability to perceive potentially harmful situations because of the impulsive behavior what the patient is having. So now what are the interventions? Always talk to the client about the safe and unsafe behavior which can harm himself as well as the other client. Assess the frequency and severity of the accidents that can happen. Set limitations on to the patient's participation or the energy which can result in the destruction. Make correct feedback to the patient and be very specific as possible. Say, for example, you give an instruction to the client, it should be clear enough for the client. Do not jump over the stairs or walk down one step at a time. So it should be clear and concise statement when you give the instructions to avoid the accidents. Always have a continuous supervision so that the patient will not blow up with the manic behavior. So these are certain nursing interventions that you can plan for a client with the hypomania. So overall, hypomania is a very simple topic which is less form of the mania, which is noticeably seen if the patient is having a persistent symptom of elevation in the mood, expansive mood, or irritable mood for at least a period of 4 days, is not having any other symptoms of depression. Previously, he had a recent history of depression can happen, ending up with a hypomania. And also, the symptoms are all milder form, but it is mimicking the mania. The treatment part of it is similar to the mania and the nursing intervention. So, based on the symptoms of the patient, you can plan the interventions. Hope you all have understood the topic. Thank you.